can't talk about financial toxicity without talking a little bit about the landscape of cancer care. I mean, the bottom line is there's some drivers that are really going to make cancer a continual issue in health delivery. First of all, the number of cases is going to increase dramatically in the next 20 years. At least 75% expected increase in incidence of cancer due to just growth in the population and the fact that we're shifting to an older population. There's a huge shift among the industry, pharma and device industry, in investment in oncology. Some pharma companies like Bayer have completely divested from other areas that they focused on, like infectious disease, and put all their chips into oncology because they see this is where the money's going to be. The median price for cancer drugs is now well in excess of $10,000 a month, and some of the products that are coming out are on the order of $15,000, $20,000 per month, and then there are combinations of these products. So the cost of treating cancer is exploding. So all these things, the rising cost of the drugs and the cancer treatments, the shift in cost sharing, more with consumers bearing more of the burden, kind of sets up this issue where people are at risk for financial toxicity. We were lucky that I was introduced to a federal bankruptcy judge in the state of Washington, and I asked her if it would be possible to link our cancer registry records with her federal bankruptcy records. They have a large database of this. And she signed a court order to let us do this. And so we linked our cancer registry with all the bankruptcy cases in Washington State. We then looked at the bankruptcy rates over time, and you can see the red lines for the cancer patients. We actually pulled data from LexisNexis. We got convinced them to give access to their database, and I don't know how much you know about LexisNexis. It's a credit reporting service. Basically, all of us are in these databases, so we had a pretty good population sample. And sure enough, we saw a substantial, I should say, increase in bankruptcy rates over the years. When we looked at the cancer type and the stage at diagnosis, overall, we found that the hazard rate was about 2.6 for going bankrupt if one had cancer compared to not having cancer. So what does this mean for people adhering to their cancer therapies? That's been a new area of research, and we're starting to look at it, and others. So this looked at copays and adherence to SERMs and aromatase inhibitors. So these are drugs women are supposed to take after they have breast cancer to reduce the risk of having recurrent breast cancer. And sure enough, they found that as the copays were higher, as you see here, the chance of non-adherence went up substantially. There's a lot of interest in this drug, imatinib, also known as Gleevec. So this actually is one of those rare miracle drugs in cancer for patients with chronic myelogenous leukemia who respond to this drug. Basically, it essentially cures them, but you have to be on this drug for life. And the concern is if you stop this drug, that the cancer will come back. Interestingly, the manufacturer of this drug, Novartis, has tripled the price of the drug since it was introduced. And even though CML is a very uncommon cancer, it's actually their #1 revenue drug now. And what Stacy found was that as the copayment structure changes and patients face higher copayments, those who had higher copayments were more likely to stop this drug. And the implication, of course, is that you shouldn't stop this drug because it could kill you.